Welcome to my YouTube channel. To my returning subscribers, thank you very much. Thank you for showing faith in me. Thank you for subscribing, and thank you for always coming back to watch. To the new subscribers, I urge you to hit the notification bell as well, so that you can always be notified whenever I post new videos. I post videos on general health and an attempt to enlighten people and broaden people's knowledge about their health. Let's get into the matter of today's video. Today I want to talk about acne vulgaris, or acne. Acne is popularly known as pimples. What is pimples? It is one of the commonest skin diseases. It typically appears in puberty, when the age range of 12 to 18. It can also affect people in their 20s, in the 30s, and in the 40s as well. It is very common, and it has affected almost everyone that has reached those age groups. So why is it important? Pimples can cause emotional trauma. Pimples, depending on the severity, can lead to emotional stress. Pimples can affect your confidence. Pimples can also cause pain, depending on the location and the severity. So the topic of pimples is very important, especially to those that are suffering from it. So what leads to pimples? There are a lot of factors that can interact and lead to production of pimples. Pimples can come as a result of overproduction of sebum. Sebum is produced from the sebaceous gland in the skin. Sebum comes out through the pores on the skin. When it comes out, it interacts with the dead skin cells that are pushed up through the pore outside. If this mixes with bacteria that's on the skin and it solidifies and blocks the pore, that plays as well into a pimple. It will become a pimple. So pimples come as a result of production of sebum interacting with bacteria on the skin, and sebum mixing with dead keratin or keratinocytes that or debris from the skin. So these interaction of these three can lead to pimples. Pimples can also come from hormonal changes, which is very, very common in adolescents. In puberty, there's a production of rise and fall of testosterone is responsible for expression of pimples on body. Where can pimples occur? Pimples can occur on your face. It can show up on your shoulders, on your neck, on your back, and on your chest as well. Basically anywhere that you have a lot of oil on your skin can lead to production of pimples as well. So we've been talking about what pimples are, how they come about, and there are types. The types just depends on the severity. It can be mild, it can be moderate, and it can be severe. So it just depends on how many they are and how many they are expressed. And when you look at literatures, you see things like blackheads, whiteheads, pustules, pimples. Don't get yourself mixed up in all that. This video is for those who are not in the field of health generally. So to make it easy, I'm referring to everything in simple terms. So pimples. How do you deal with pimples? Let's get to the crux of this video. How do you deal with pimples? What can you use at home? What over-the-counter medications can you use for pimples when you start having them? Before I get into drugs, let me talk about simple things you can do to prevent or to deal with them. Pimples usually associated with blockage of your pores on your face. So if you wash and rinse your face or the affected parts like twice a day with simple non-harsh soaps and clean water, you can deal with it. It will go a long way to help dealing with pimples. Another thing you can do is avoid wearing heavy makeup, which can block your pores. That will lead to pimples. And also, if pimples might come when you are approaching your period, as in the reproductive age group, when you're approaching close to your period, pimples might show up. These ones are usually most times self-limiting. You don't have to do anything about them. They will go on their own. And another thing you should know is avoid the use of indiscriminate use of antibiotics. So whatever you're taking should be something recommended or prescribed by a medical practitioner. So let's get into how you deal with pimples. So I aim to make this video very short. So let's get into the drugs. So there are 4 agents you can actually use for the topical agents to treat your acne. Well, the salicylic acid solution 2% and the azelaic acid. I'll list them up here so you can see. The azelaic acid 20% cream, benzoyl peroxide solution or cream, and the tretinoin cream. These creams are available over the counter. You can get to treat your acne. Most of them are prescribed as to apply twice a day over the affected parts. Too much of everything they say is bad. Moderation is key when applying. So these products can be used to treat your acne. When it gets serious, if it's a mild to severe type of acne, I would recommend you go see a dermatologist or a medical doctor who can go further to prescribe oral medications like antibiotics, clindamycin, erythromycin, and some other antibiotics that can be combined to clear the infection that causes this acne. So I won't bother you with the names of some of these bacterial infections that could lead to acne, but these are the basics that you should know. So whenever you see acne on your face, please don't rush to break them or burst it. When you do that, you cause more infection and scarring. It will leave a scar when it heals. That's what it means. So avoid scratching, avoid applying anything you see on your face, avoid touching your face, avoid trying to break open the pimples whenever they come out on your face. So when you do this, you will be fine. When you do this, you will have a better result at the end of the day. You should be patient as well when you are treating acne, because sometimes it takes weeks to respond to treatment. So you should be patient and expect it to take time, so you get a better result at the end of the day. If you've enjoyed this video, please don't forget to like and share, and also subscribe. If you have not subscribed yet, hit the subscribe button. Thank you. I post videos every week, and videos are sure to be educating and enlightening. So thank you very much. Cheers.